Let's say you're about to go into surgery. You're nervous, which is understandable, but then you find out your insurance might limit their anesthesia coverage.
It's certainly a worrying thought, and it almost happened to some Anthem Blue Cross Blue Shield patients.
So it's like this battle between cost-cutting and patient care.
Exactly. And Anthem's plan, which has been paused for now, was to deny claims that went over certain time limits for anesthesia during specific procedures.
So basically, they wanted to standardize anesthesia coverage.
Uh-huh. The policy was supposed to be for patients in Connecticut, New York, and Missouri.
Did they say why they wanted to make this change?
They said it was to stop overbilling and make healthcare more affordable. They claimed the time limits were based on what the American Society of Anesthesiologists considers standard.
I'm sure the anesthesiologists had some thoughts on that.
Oh, they did. The American Society of Anesthesiologists called it a lot of things: unprecedented, egregious, uninformed.
Why were they so against it?
They argued that every patient needs different care when it comes to anesthesia. They said complications can pop up unexpectedly, and that patient safety should come first, not just sticking to a strict time limit.
So they felt like Anthem was making things too simple.
Yeah, one billing code can cover almost 200 different procedures, and each one might need a different approach to anesthesia.
How could they even think about setting a time limit when one code covers so much?
That's what the ASA said. Dr. Gordon Morwood, the vice chair of their Committee on Economics, said that Anthem didn't even look into whether there was actually a lot of overbilling before trying to make this change.
So if they didn't even know if overbilling was a problem, why would they do something so drastic?
Well, Dr. Morwood thinks Anthem might have had another motive. He said they might have known that some doctors and patients wouldn't fight back if their claims were denied. It would have saved Anthem money.
That's a bit worrying because it means some people who couldn't afford to fight back might have lost out on care they needed.
It definitely brings up some ethical questions like who should be the one to decide about medical care, the insurance company or the doctor? Yeah, it definitely seems like money came before patient well-being.
And to make matters worse, it's actually hard for anesthesiologists to overbill for their time.
That's true. They have to keep such detailed records that it would be really difficult to pad their bills.
So if they're not trying to overbill, why would they need extra time?
Well, a board-certified anesthesiologist, Dr. Rick Van Pelt, explained that any extra time is usually for the safety of the patient.
I see.
Things like making sure the patient's airway is clear, dealing with blood pressure changes, or problems breathing during the surgery. All of those things need the anesthesiologist to be ready to act.
So they need to be able to react to things that come up during the surgery.
Exactly. Dr. Van Pelt actually warned that if you put time limits on anesthesiologists, it could lead to more medical errors and put patients at risk.
That's a scary thought that someone's well-being could be at risk because of an insurance policy.
Yeah. It could really damage the trust between patients and anesthesiologists, even though this particular policy was stopped.
People are already nervous about surgery. This kind of policy just makes it worse.
You're right. It shows how much power insurance companies have over patients. Dr. Morwood used an interesting analogy to explain this.
What was it?
He said that putting a time limit on anesthesia is like having a meter running out while someone's life is on the line.
That's a powerful image. It really shows how important it is to make medical decisions based on what the patient needs, not just how much it costs.
It reminds us that healthcare is about people's lives, not just money.
It's interesting that Anthem decided not to apply this policy to maternity care or kids under 22.
Yeah, that makes you wonder why they made that exception. Were they acknowledging that those types of care are more complex, or were they trying to avoid getting into trouble over something so sensitive?
It's hard to know for sure, but it definitely highlights the challenge of balancing costs with patient safety and ethical considerations.
We definitely need a better way to approach healthcare policy.
Even though this policy is gone, it feels like similar problems are going to keep coming up as healthcare costs go up.
You're right. We need to find a way to keep costs under control without putting patients at risk or damaging the relationship between doctors and patients.
It's a tough balance to find.
It is.
Yeah.
And patients often end up stuck in the middle. Think about being the patient on the operating table, knowing that your insurance company is putting a limit on your anesthesia.
That would be terrifying.
It would definitely make it hard to trust your medical team and focus on getting better.
This whole situation really shows just how much power insurance companies have in our healthcare system.
They have a lot of power. We need to stand up for patients' rights and make sure their voices are heard when these big decisions are being made.
These medical decisions should be made by doctors and patients together, based on what's best for the patient, not what saves the insurance company the most money.
I agree. This is a complicated issue that we need to keep talking about because what's at stake is too important to ignore.
At the end of the day, we're talking about people's lives, not just dollar signs.
Exactly. And we need to remember that when we talk about healthcare.
It seems like there needs to be more transparency in healthcare so everyone knows what's going on. So what can we do to make sure patients' needs are really coming first, especially when there's so much pressure to save money?
It's a tough question with no easy answers. We need to start by being open and honest about how things work. We need to talk about these practices openly and help people understand them so they can speak up and demand better from insurance companies and people who make policies.
That sounds like a good place to start. If patients know how these policies are made and how they might affect them, they can fight for themselves.
Exactly. We also need to support doctors when they disagree with policies that could harm their patients. Their medical knowledge and ethics should matter more than some rule made by an insurance company just to save money.
It feels like if we let medical decisions be guided by evidence and not just insurance company rules, everyone would be better off in the end.
I agree. Focusing on quality care and patient safety leads to better outcomes, and that actually can help lower healthcare costs in the long run.
That's a point that often gets missed in these discussions, where it's all about saving money right now.
It's thinking about the short term, not the long term. We need to focus on what's valuable and sustainable in healthcare.
So what's the most important thing for our listeners to remember as they deal with their own healthcare?
Stay informed and stay involved. Understand your insurance policy, ask your doctors questions, and don't be afraid to speak up if you feel like your care is being compromised. Your voice matters, and you have the right to advocate for yourself.
I think that's a great note to end on. It's crucial to remember that in healthcare, we're dealing with people's lives and well-being, not just numbers and profits.
Absolutely. Putting patients first is the most important thing. And by having these conversations and raising awareness, we can work towards a healthcare system that truly prioritizes the needs of every individual.